Cubital tunnel or ulnar neuropathy causes numbness and tingling in the ring and small fingers, in some cases pain either in the fingers or elbow. The purpose of this video is to explain to you what that means, as well as to inform you of alternatives to surgery, risks, and potential benefits. I will also attempt to answer some of the common questions asked about this procedure by patients who I have talked to about this over the years. There is additional information available about this and other hand and arm conditions we treat on our website, floridahandcenter.com. Cubital tunnel syndrome results from pressure on the ulnar nerve at the elbow. The ulnar nerve travels along the inside of the arm and forearm, and then through the palm to the muscles in the hand, as well as the ring and small fingers. Some people refer to the ulnar nerve at the elbow as the funny bone. It is the second most common nerve problem that we see in the arm after carpal tunnel syndrome. The symptoms range from mild to disabling, and if untreated can frequently be much more serious than carpal tunnel. The ulnar nerve provides sensation to the small and part of the ring finger, but more importantly controls most of the small muscles in the hand that give you grip, strength, and the ability to handle small objects like picking up a pen. Severe ulnar neuropathy leads to muscle loss and a poorly functioning hand. Although it is seen more commonly with other conditions like arthritis or diabetes, many patients have no clear risk factors. The diagnosis of cubital tunnel syndrome is considered when patients present with symptoms of numbness and/or tingling in the small and ring fingers. The diagnosis is confirmed with an examination. Nerve testing is also helpful in determining the severity or presence of nerve damage, predicting recovery, and screening for additional areas of nerve compression. Non-surgical treatments for cubital tunnel involve reducing pressure and tension on the ulnar nerve at the elbow. Patients are instructed to avoid leaning on the inside of the elbow and to also not keep the elbow in an excessively bent or flexed position. These maneuvers will often be effective in mild cases and should be tried before surgical treatment is considered. Surgery for cubital tunnel is designed to reduce pressure on the nerve at the elbow. Like many other problems, there are many different ways to do this. The simple procedures range from non-invasive to extensive and complicated. For more than 13 years, I have performed what would be considered the most invasive, extensive procedure. The results have been consistently good, but the recovery for the patients has sometimes been challenging. Strong pain medication, hand therapy, and an extended period of limited use of the operative arm have been required. My success with endoscopic carpal tunnel surgery, with its easy and fast recovery, has led me to look for a similar approach for this cubital tunnel. The exhaustive reviews of the results from all ulnar nerve surgical techniques have not demonstrated any single method to be superior. So why not do the easy procedure with quick recovery if the more extensive one is not clearly better? Recent advances have provided this for me, and combined with very favorable clinical reports from my colleagues, I now perform endoscopic ulnar nerve surgery. Endoscopic ulnar nerve surgery is performed in an ambulatory surgery center or as an outpatient at the hospital. You are given sedation through an IV, much like that for an endoscopy or colonoscopy. Some people refer to this as twilight. There is no need for general anesthesia or a breathing tube. Once sleepy, I will then inject your arm with a long-acting local anesthetic so you will wake up with no pain. A small incision is made on the inside of the elbow, and the ulnar nerve is carefully decompressed using special instruments and a tiny camera called an endoscope. The incision is closed with medical superglue and a light bandage is applied. The procedure is completed in minutes, and you are in the recovery room and on your way home very quickly. Like any medical procedure, there are no guarantees, and there are some risks. These risks include infection, tendon, artery, or nerve damage, and poor healing. Fortunately, these risks are very uncommon. After surgery, you are able to use the hand for light tasks immediately. This is not a procedure that incapacitates you. We will ask you to be kind to your hand and arm for a couple of weeks after surgery, but most of your daily activities will be minimally affected. My nursing staff will check with you about a week after the procedure, but feel free to call us at any time with concerns. Relax. I take this and any procedure very seriously and will do everything I can to assure you have an easy experience and a quick recovery.